Guys, you'll be having a long list of we'll be having a long list of uh, um, diseases of cardiovascular system that are of surgical interest, right? So diseases of cardiovascular system that are of surgical interest. You guys just hold on for me. Right, so diseases of the cardiovascular system that are of surgical interest. This is just a picture of medical practitioners with a heart so large, right? Showing us that heart diseases are actually a day-to-day disease that you come across them once you start practicing, right? So cardiovascular disease, let's have an overview of it. Cardiovascular diseases affect your heart and the blood vessels, and almost half of all adults in the USA have at least one form of cardiovascular system disease, all right? So like I told you guys, it's a day-to-day disease that you come across it once you start um, practicing. Okay, so you may make lifestyle changes to manage cardiovascular system diseases, or your healthcare provider may prescribe some medications, right? So if you're doing some things that actually resulted in your cardiovascular system diseases, then you have to stop it. That's when they finally diagnose you with it, right? So the sooner you detect cardiovascular system diseases, the easier it is to treat it. All right. These are the different types of cardiovascular system diseases: heart failure, pericarditis, cardiomyopathy, cardiac arrhythmia, aneurysm, and so on and so on. Right. So these cardiovascular system diseases could be actually congenital. You might be born with them, okay, or it could be acquired. It could be maybe later on in life, different things happened, or maybe you took down on a lifestyle that you actually got it. All right. So this congenital cardiovascular system disease could include congenital heart defects. And these congenital heart defects include maybe like any damage to any part of your heart. All right. I think one should be and tetralogy of Fallot, okay, tetralogy of Fallot, where you have all this ventricular hypertrophy and all that, right? Then we have aortic coarctation. Aortic coarctation. I'm coming. Let me. I knew this before, but I actually forgot it. Aortic coarctation. Okay, aortic coarctation is actually narrowing of the aortic vessel, right? And this can be congenital too. Then how about acquired? All right. Acquired could be traumatic. It could be valvular disease of the heart resulting in heart murmurs. All right. So this is basically like you have the tricuspid valve, you have the bicuspid valve, you have the aortic valve, you have the pulmonary valve. So if there's anything wrong with any of these valves, it results in these valvular diseases. They are about constrictive pericarditis. You know that pericarditis is basically inflammation of the pericardium, okay. Then we have lung cancer, of course, that's literally. Then we have aortic aneurysm. Aortic aneurysm is basically like inflammation of the aorta or bulging of the aorta. Then lastly, what another thing that can be here is pericardial effusion, okay, which is actually fluid, too much fluid in the pericardial cavity, thereby it is constricting the heart. Okay, so guys, this is it, and this is a list of diseases of cardiovascular system that are of surgical interest. Okay, so see you guys now.